Okay, so we did our environmental and cultural factors on undocumented immigrants and Spanish-speaking individuals. So here's our health concerns. So for the cultural environment, media has portrayed Latino immigrants as criminals and threats to the nation and national security. Immigration is often portrayed as being a problem and that the borders are out of control. Latino immigrants are often seen in the media as a problem and referred to as illegals, where immigrants from Europe are often referred to as exchange students or foreign visitors. Latino immigrants are also described as violent smugglers who bring drugs and weapons into the country and do not have much education. These assumptions are not always accurate and can have an influence on how these individuals shape their lives. Media portrayal on these individuals can put them in harm because of the negative connotation surrounded with Latino immigrants. Family support becomes very important when people become isolated. Children often learn English through schooling and begin to translate for their parents who may not speak English. For the parents, it becomes essential the children be with them for important events such as doctor visits and or grocery shopping. Increased stress for children in these cases because they do not want to disappoint their parents, but there is less time for studying and doing things they want to do. This psychological burden can lead to child-parent alienation, where the child feels that the parent does not understand their feelings or concern. In turn, this can also affect the child-parent dynamics. Authority may be compromised. So, role of peers can become very important as well. Feeling like a part of a group or belonging is important for mental health. In this case, role of peers is usually supportive and helpful. Church groups can help with a place of safety and acceptance, and some provide programs to help provide food and shelter as well. And that is by the Catholic Community Services of Utah, 2019. Support groups can also help these individuals to get the resources they need. Peers can help make these individuals aware of these resources and help them to utilize them. So Latinos have a lower likelihood of seeking and receiving healthcare services than the total U.S. population. Lower access to and receipt of healthcare is related to lower health insurance coverage and language barriers. Language barriers, transportation difficulties, low socioeconomic status, inflexible work schedules, different cultural norms in the U.S., and anxiety and fear related to anti-immigrant political climate negatively impact Latino immigrants' frequency of contact with the healthcare system. The anti-immigrant climate caused immigrants to experience fear and distrust of institutions, which in turn can lead to increased feelings of marginalization, poor mental health, and missed appointments or unfulfilled prescriptions. These negative health behaviors and practices led to negative health outcomes such as uncontrolled hypertension, diabetes, and lack of preventative health screenings. These behaviors can become cyclic and pass on through generations. So, to qualify for DACA, a child had to have entered the United States before the age of 16, lived continuously in the United States before June 15, 2007, be currently in school or honorably discharged from the military, and met other requirements. Meanwhile, a study has already proven that DACA is tied to better mental health for children of immigrants. These children have grown up, have a career, have children, and pay their taxes. This program has helped undocumented immigrants have a better life. So language barrier, like stated previously, is a definite problem and can bring stress to these individuals when accessing healthcare. Some cultural barriers that may make this population more vulnerable are the use of home remedies to avoid or delay treatment, or use alternative medicine rather than accessing healthcare. Also, the belief in some folk illnesses may make the population more vulnerable because not everyone may know these illnesses. Another barrier to accessing healthcare is feeling guilty about being sick and not being able to help around the house and fulfill roles. All of these barriers could potentially further distance these individuals from society and increase the feelings of them not belonging here. So danger is deportation and being parted from their children. In recent media, we have seen families being torn apart and being sent to detention centers. Their children are left alone and worried about their parents. So many undocumented immigrants come to the United States for work, and this is by Guzmano, 2012. And they come to have a better future for themselves and their family. So people discriminate by the color of skin in undocumented immigrants, by the different language they speak, by the accent, by the way they dress, based on their culture, and race and ethnicity. Just people, there's people out there who do not want to accept others who look different than themselves or what they view as normal. But this can affect health outcomes by people not accepting this population when they need help and services. So religion for undocumented immigrants can be considered a safe place and a place of worship. So according to the website to the Church of Jesus Christ of Latter-day Saints, it provides immigrant services, gives people services and resources they need in their communities. So this is usually perceived with a lot of gender type things. So people view males as more violent, and this could affect the health outcomes by refusing health care to those who may have a criminal background. And in my opinion, I feel like it would be more difficult being undocumented and transgender, for example. People would most likely be less acceptable. The geographical location can affect this population because there may be less access to healthcare, health, food, and transportation. Latinos in non-traditional migration areas often live in isolated neighborhoods and lack the necessary healthcare and resources to support their needs. Physical location, economics factors, distance, and transportation has been described as the top barriers to accessing healthcare. Rural areas often have fewer medical service facilities and may not provide interpreter services, making individuals travel further to access care. Transportation is another barrier, limited bus routes, and transportation to medical service facilities. These factors have a negative effect on health outcomes for this population. Accessing healthcare is the biggest concern for this population. Telehealth makes medical advice, diagnosis, and prescriptions available in rural areas without in-person visits. This can help remove barriers like distance, traffic, and inflexible work hours. Individuals can reach a healthcare provider by video or secure email, which may help the stress of interpreting. Telehealth may have more options for interpreting. Telehealth is more convenient and can reduce costs of healthcare, which may help this population and their health outcomes. So people assume that undocumented immigrants are Mexican. There are other undocumented immigrants that travel all over the world, from all over the world. Social media tends to focus on what the main topic is and spread it like wildfire. There is more Latin undocumented immigrants here in the United States, but people are more biased on thinking undocumented immigrants are all Mexicans. Implicit bias is that babies do not have a voice for themselves. When an undocumented baby is brought into the U.S., it is not their fault. It is also not fair for them to be treated unfairly when it wasn't their choice in the first place. So yes, in areas that are not as rural and have multiple resources, in these areas there have been evidence that the mortality rate in these areas are decreased. Knowledge about resources can be more of a barrier than availability for this population. So having education campaigns to help this population become aware of existing services may help these disparities. Being in an area that has more Spanish-speaking individuals can impact this population by feeling like they belong and having more peer support, which they can help increase health outcomes. And here are our references.